Welcome, everybody, to our Leadership in Action webinar series. We are very excited to have Dr. Scott Rivkees join us. I'm going to quickly introduce him. He has a very impressive leadership background, but I'm going to try to incorporate as much as I can so that we can get onto the questions. But welcome, Scott. Thank you for joining us. Dr. Scott Rivkees is the interim chair of Health Services Policy and Practice and the academic director of our accelerated MPH program for clinicians, as well as our Masters in Health Leadership program here at Brown University School of Public Health. Dr. Rivkees is a pediatric endocrinologist and physician scientist who has served as Florida State Surgeon General and Secretary of Health from June 2019 to September 2021. As State Surgeon General, Dr. Rivkees also served as State Health Officer for the Florida Department of Health. Prior to that, he served as chair of the Department of Pediatrics at the University of Florida College of Medicine and physician-in-chief of University of Florida Health Shands Children's Hospital, part of UF Health Shands Hospital and the University of Florida's Academic Health Center. He graduated from Rutgers University and the University of Medicine and Dentistry of New Jersey. He received residency, fellowship, and postdoctoral training and served as faculty at Mass General Hospital, at Harvard Medical School. Before moving to Florida, Dr. Rivkees served as a professor of pediatrics with tenure at Yale. As associate chair for research, he served and directed the Yale Pediatric Thyroid Center, one of its first of its kind in the United States. We are very excited to have him here at Brown University as one of our prominent leaders at the School of Public Health. During his career, Dr. Rivkees has been named one of America's best doctors, one of America's top pediatricians, and one of New York's best doctors as well. Dr. Rivkees has more than 35 years of continuous research funding from the NIH. He has over 250 publications. So thank you. Dr. Rivkees, for being with us today. We're very excited for you to join us in our Leadership in Action webinar series that is hosted by the MPH online program. This is a program to connect prominent leaders to the students that are joining us from around the country and the world to just get to know us a bit more, get to know the leaders at Brown. So without further ado, I'm going to have our Nithya introduce herself, and then also the MPH grad students that will be co-moderating this event.
Thank you so much, Jen. Hi, everyone. I'm sorry I had some internet connection issues earlier. Thank you, Jen, for taking over being the host. I'm Nithya Ramesh. I think I know almost all of you on this call. I am the manager of MPH programs at Brown University. I'm also a dentist, and I'm specializing in dental public health at the moment. I'm getting my doctoral degree, so I know exactly how it is to be in school and working at the same time. Like you all, I'm going through the struggle with you all. And I'm really excited to have Scott here. I've worked closely with Scott over the last year, and he's an amazing, wonderful colleague. So I'm really glad we have him here today and that we're getting to hear from him about his experiences. I'll turn it over to David to introduce yourself.
Thank you very much. My name is David Shaptai. I live in Boca Raton, Florida. I'm the director of a social service agency here in the area that helps community members with financial difficulties and other types of challenges and helps them get through them. I have a background in medicine, Jewish law, and bioethics, which is how I got to public health through a more of a ethics policy lens. And then I'm thrilled to be able to be here and to speak with you tonight.
Good. So could we have Veronica, then DM, and then Daniel introduce themselves?
My name is Veronica Leary. I'm a current OMPH student at the Brown School of Public Health, and I live in Orlando, Florida. I'm currently working in data and spatial analytics for the U.S. State Department and the USDA, particularly on projects related to food insecurity. I've also been working with Prava Health, which is a healthcare provider in Southern Asia, on the development of a new telemedicine site and their user testing metrics. Before attending Brown, I studied quantitative modeling and statistics at the University of Pennsylvania and climate change and human health at the Yale School of Public Health. I'm honored to be part of the OMPH Leadership Series and to help moderate this session.
Thanks, Veronica. DM?
Hi, my name is Dana Marie Thomas. Please call me DM. I'm a cybersecurity and resilience researcher at the National Renewable Energy Laboratory. In terms of my background, it includes a background in public policy, cyber and energy security, including cybersecurity for critical infrastructure and regulatory compliance. At NREL, many of the projects that I lead and support involve me providing technical assistance to communities and orgs in planning and implementation of clean energy projects. I am one of the community leads at the Department of Energy for Communities C2C Expert Match, where I help and work with underserved rural BIPOC farming communities, particularly around agrivoltaics. I am interested in the nexus of energy, water, and food systems, including the intersection of public health and renewable energy. And basically, my goal is to help advance the energy transition by leveraging clean energy power technologies to promote human health and empower resilient communities. I'm happy to be here. And I also reside in Deltona, Florida, in Volusia County.
Thanks, Daniel.
Hello, I'm Daniel Schwartz. I live in Boca Raton, Florida. I'm a marriage and family therapist and mental health counselor, specializing in working with families and family systems where someone is traumatized, including multi-generational trauma. I have a degree in economics and a graduate degree in philosophy and history from Harvard College and Graduate School of Arts and Sciences. And I'm the former chair of the Gavi campaign, which is a rather large funder of childhood vaccines globally. I also was the executive director of the Elie Wiesel Foundation. One of the things that was most fun was organizing our annual conference of Nobel laureates. And I'm also the former CEO of the Porticus Foundation, which is a granting foundation active in 90 countries around the world from 12 offices, and currently serve as the co-chair of the Atria Health Collaborative, which funds in hypertension reduction locally, nationally, and globally. But I'm a very, very proud online MPH student at Brown, and I love the cohort and I love the program.
Thanks, Daniel. So I'm going to turn it to Veronica. She's going to kick us off, Scott. She is going to start off with some questions about just your career trajectory. Veronica?
Actually, can I say something first, Veronica?
Sure.
I mean, it's incredible hearing your backgrounds. I mean, I really am humbled speaking with you. So thank you for this opportunity. David, we've worked together before, and also I have to thank you for joining the online MPH program. This is an incredible program, and hearing your backgrounds, I mean, it just makes that program so much richer, and a huge thanks and admiration to Nithya and Jen for leading this this program. Putting together these programs is really, really complicated, and it serves a really important mission. So, thanks to the two of you for being friends and colleagues, also, and also for any talk where we're talking about COVID. You know, we've lost more than 1 million people in the United States, probably more than 100,000 people in Florida. And, you know, the thoughts of the people we've lost really is what drives us on and always remains in our hearts.
Thanks, Scott. Veronica?
Hi, Dr. Rickies. It's a pleasure meeting you this afternoon. Public health appears to draw individuals from a broad range of fields, and often the trajectory into public health is neither linear nor direct. Could you tell us a little bit about your background and what led you into the field of public health?
Yeah, well, thank you. You know, I tell you, if you asked me 10 years ago, would I be at the Brown School of Public Health at this part of my career, I would have said absolutely not. And yeah, careers are winding pathways, and that build on things that you had done before. So in terms of how I got into public health, so I'm a pediatric endocrinologist, and one of the most important public health successes is newborn screening, where children get tested for either hormonal deficiencies, inborn errors of metabolism, which can lead to severe intellectual impairment. So this ended up being, part of my training. I moved from Boston to Indiana. And when I moved to Indiana, what I noticed was that only a quarter of the children in the state were being treated appropriately for congenital hypothyroidism. Too low a dose, too late. And even though basic science researcher at the time, having clinic one afternoon a week, I went to the Indiana Department of Health, said this is an issue we have, and we came up with a solution. We started the Indiana Congenital Hypothyroidism Follow-Up Program, which still runs now. And overnight, kids went from inadequate treatment to perfect treatment. Then I moved from there to Yale and got appointed to the Connecticut Genetics Advisory Committee. As part of that, ended up working with Senator Dodd, Senator for Connecticut, who was on the HELP Committee, and worked with him on the Newborn Screening Saves Lives Act. When I went to Florida, as department chair, as the Floridians know, it's a big state. In University of Florida, we've created programs for kids with medically complex conditions in the northern part of the state, had child protection team programs, early intervention programs, and those programs really brought me into working with the great people in the Florida Department of Health. And after being department chair for 7 years, somebody said what I consider being Surgeon General, and we had accomplished a lot at UF, and the ability to think about how you influence individuals' healthcare rather than one patient at a time, at a much broader swath. Made me think about this and began thinking about what are the things we can do to help the people in the state of Florida. And so went through a series of interviews and decided that this would be something where, I thought I could, have an impact on the state.
Wonderful. Were there any particular mentors or even words of advice that you received early in your career in public health that guided your interest in the field or shaped your philosophy towards public service?
I would say it even starts before then. Yeah, so I was a runner, an athlete, and in high school, I had an incredible track coach who pushed me and showed me that you can do more for yourself than you're capable of. That person was John McDonald, who ended up coaching Arkansas and won almost 30 NCAA titles. And then as a undergraduate, I started working with pediatric nephrologist at the medical school in New Jersey, Burton Fine, and he really pushed me as well. That out of your comfort zone, how to work hard, and that's one of the reasons why I went to med school where I did, so I continue to work with him. And then during my training at Mass General, just really wonderful, wonderful people. I know Daniel spent time at Harvard, going there with an inferiority complex from a state school. You sit there and you think it's a boorish environment. It wasn't like that at all. I worked with great people, and the laboratory mentor I worked with was Stephen Reppert, a neuroscientist, and we worked hard. And I think all of us at Harvard got the same speech. Listen, Scott, you're smart, but you're not smart enough. And the only way you're going to be competitive here is if you work nights and you work weekends. And so from my fellowship on, even till now, I've always taken that with me. When I spoke with my other colleagues who trained at Harvard, they all got the same speech. So, it's still curiosity, how to be curious about things, how to be creative about things, and how to work hard.
So you have worked as a practicing clinician, a professor of medicine, and a state surgeon general, and therefore in both the public and private sectors. What insights do you have about how these various fields operate or the particular challenges public health professionals face when working with public-private partnerships?
Yeah, really interesting question. So working in the Department of Health, was actually different than academics. Academics, a lot of deliberation goes on. Public health, there's a different timeline. So for example, when COVID hits, you don't have the luxury of time to make certain types of decisions. And whereas academic, I think in terms of how people view themselves, I think it's more of a flat platform with a lot of people having equal voices. In state agencies, it's more hierarchical. And I remember when I started there, first day people saying our job is to support you. Well, that's not the type of environment I came from. We're really used to a lot of open, there's a lot of open discussion in the Department of Health, but it was structured a little bit differently with that. So, but I will say, when leading, when I was chair at University of Florida, in addition, we had outreach programs in Orlando at Arnold Palmer Children's Hospital, Student Family Hospital in Pensacola. So it really led a big group of physicians, and learning how to work in complex organizations was really, really useful. Florida, the University of Florida system, it's a sunshine state, meaning total public records. Anybody can request anything on your computer, any email at any time. And same thing when you go to the Department of Health. And so, having had administrative experience, knowing how to work within state systems, I thought was really useful. And then the most important thing is, knowing who are the members of your team, who are the great members of your team to be able to rely on. And I always like the old dictum, decisions made by a group are better than decisions made by an individuals, and decisions made by a diverse group are better than those by a homogeneous group. So, when I was at UF, when I was at Department of Health, really had a fantastic team to work with.
Absolutely. Given your own experiences in public health and the way in which you ultimately entered the field, is there any particular advice that you would give to current or even potential OMPH students regarding public health as a potential career trajectory?
Public health is so incredibly broad, so incredibly vast that there are few other fields where you can really follow your heart in terms of what you want to and what you're interested in, whether it's protecting children, whether it's community health engagement, whether it's basic biostatistics and epidemiology, uh, whether it's working with disadvantaged families, individuals with Alzheimer's disease. I mean, public health, it's about the public and it's about health. So you can add, whatever is in your heart, you really can pursue.
Thank you, Dr. Ripkes. I'm actually going to hand the questions off now to Daniel.
Sure. What would be helpful? It's clear that you have a strong moral and ethical compass, strong clinical experience, strong public health, referenced epidemiology and the like, and tremendous political experience. How do you balance all of those possibly competing or conflicting interests in ways that allow you to stay true to your own moral compass?
Yeah, well, I don't think they're competing or conflicting at all. I mean, we get our values from our parents, our grandparents, from our communities, our friends, our religious organizations that we belong to. I mean, it's you know your moral compass is something that you have with you, all the all the time. And certainly there was a time where it got to a point where I was asked to do, there were certain policies that were enacted that I would disagree with, and I would, state my objections, about that. One of the things that was really interesting is, despite what you see on CNN, C-SPAN, things like that, there was no yelling, in the Department of Health. We would have very open conversations about what our differences were. And, I really appreciated that type of frank dialogue. But, if there were certain things that somebody was suggesting, I would say, no, we can't do that. That's not a good idea.
No, thanks for sharing that. When you think of your current role or other phenomenally important roles in which you serve, to what degree were you able to plan the trajectory, and when did serendipity take over?
Yeah, I would, it's interesting. I've worked with some colleagues where they plan everything. I'd be an assistant professor by this age, associate professor this age, department chair, professor. I have never been that way. I've always enjoyed what I'm doing, and have basically followed the lead. You mentioned serendipity. Uh, that comes from the Persian princes of Serendip, who had to follow a particular, clues, that they'd look for a camel that dragged its leg, that spit out the right side of its mouth to identify the stolen camel. And a lot of it is just about following leads. So, uh, so as being in a laboratory, I mean, everything is about, what you find and what's the next discovery. Keep pushing for for what's next. So, again, getting back to the point I was making earlier on, when I look for success in different fields, whether it's medicine or other areas, creativity and being able to work hard and building off what you've done before makes a difference.
We all benefit so much at the Brown School of Public Health from your presence, and you've been a great connector and introduced some wonderful people to the school. How did you originally get connected? How did
Uh,
Brown become part of your trajectory?
well, if I can talk about connections with Brown, one of the things I learned in clinical medicine, that if you have a really difficult question, you don't know the answer to, go to the top person in the country or internationally who might be able to give you advice. Same thing for research. I had international collaborators. And then when I became Surgeon General, uh, I would talk with the highest levels. I went right up to the top speaking to people. I talked to Rob Redfield, CDC director regularly, Steve Hahn, FDA commissioner, Bob Kadlec, ASPR, Jerome Adams, US Surgeon General. So I always believed in speaking at the highest level individual where you can get the most information from. Now, the other people I used to speak with were journalists, because during the pandemic, journalists really like to pick on Florida. And, I should mention that last week they had the Florida Man Games in St. Augustine. I did not participate, but if I had a mullet, I would have. But uh, so I used to also speak with journalists, and one of the people, or people you'd see on TV, and Ashish Jha was such a great communicator during the pandemic. And in terms of trying to connect with people, I know I needed to connect with people at the Harvard School of Public Health. And Ashish was one of the people that I would speak with. I lived in Tallahassee during the week, and I had my research lab going on the weekends in Gainesville. And when I could go back from Gainesville to Tallahassee to Gainesville, 2.5 hours, I'd drive Friday night there and back Sunday. I'd always be on the phone speaking to different people. And it was out of these conversations with Dr. Jha, where he said, what are you thinking about next? And I said, I really like public health. And he said, what about here? And so it was like that, what's that movie with Tom Cruise where you had me at hello and he had me at hello?
Well, thanks for sharing that. And now, David,
David, thanks. Thanks, Daniel.
thank you so much.
Thank you so much. I wanted to ask you a little bit of.
You're on mute.
You've been muted.
Sorry about that. I wanted to ask you a little bit about your experience as a Surgeon General in Florida, um, which Jen just shared an article that you wrote about public health in Florida today, trying to read at the same time. But suffice it to say that I think whether it's true or not, as you mentioned, the news portrays Florida as not the most friendly to public health. It could be considered to be a challenging environment, and yet public health, as you noted, is a lot about dealing with people, convincing people, getting people on board with a particular agenda. So wanted to just know, how did you manage to do that? How do you manage to work with such an environment with people who may not share your view? And any advice that you have for us, future leaders in public health, how we could learn from that experience?
Yeah, no, really important question. So I remember somebody interviewing President Obama once, and they said, "How do you do your job with so much swirl, politics, conflict, personal attacks around you?" And he said he just comes in every day, doesn't read the media that they write about him, and just sit there and do your job. And so during the pandemic response, the Department of Health played a major role. So did the Division of Emergency Management. Jared Moskowitz was director of DEM. Jared is now U.S. Congressman. I'm really, really proud of him being in that role. And my day would start at 6 o'clock in the morning. I'd look at the data, things which are coming in, what are the things that we needed to address in a very methodical way, and just focused on the issues of the day. And it was also interesting, over the first, I would say, the first case of COVID was March 1st of 2020. And really over that first year, I would say the red states and the blue states really were very much on the same playbook. Then I think you started to see diversion where the red state governors would do one things, the blue state governors would do different things. For example, the red states opened up the schools, less restrictions on businesses. The blue states, the kids continued to stay home from schools. And what would end in, starting around that divergence time, this is when the governor went from being very much in favor of vaccination to not talking about vaccination, then focusing on monoclonal antibodies, and then, really, a really shift in position. But what Jared and I did every day, we came in and we did our job. And I will say that through the time that I left, we did not have interference in what we were doing, even though governor may be saying something different. We stay core to our principles. I recently wrote an article which came out last week. It's in Frontiers in Public Health. It's a big treatise about what happened in Florida. I think it's called the shifting impact in response to COVID-19 in Florida, where I actually detail the different things that we did. But again, what's your job? Focus, 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 do your job, and try to avoid the swirl.
Thank you. That's very helpful to know that, first of all, it's great advice and that it's possible, given that, from at least my perspective, I only saw what was going on the outside. It seemed like it was not a very supportive environment, but to know that you can still focus and do that,
I would say you learn to become a rhinoceros. You have a very thick skin, and you end up getting lots of brutal personal attacks, some nasty letters, threats, things like that. I had to get security for my house and things like that. Some of our health officers, things got really testy with kids going back to school. That really created so much conflict because, parents, they care so much about their kids and make sure they're doing the right things. And, we had health officers followed after school meetings. They had fellow health officers buy guns. This is, many state health officers. My colleague in Georgia, she had state police protection for months and months because of threats that you have. So, even though I'm trying to minimize, sit down, do your job, it was a difficult, difficult environment to work under.
Wow. I'll just follow up, I guess, on that, on the some of the challenges that are involved. I guess maybe a silver lining might be that people learn to be passionate about public health. And either they're expressing it in a negative way, maybe security, but at least feeling passionate about the issues. And you wrote recently in Time about the current measles epidemic in Florida, where it seems like the guidance is not being very supportive. So, given your experience in dealing with people who may or may not be as supportive of the public health effort, what advice would you give for our co-moderators here all in Florida for supporting or promoting positive public health messages in light of what is otherwise seems to be not the greatest, or not in sync with other guidance that's being provided?
That's such an important point, and it's not just Florida, it's the rest of the country. So in more than 20 states, laws have been passed rolling back public health authority. Laws have been passed rolling back the authority of governors to declare public health emergencies. So it's something that transcends Florida, but one of the really, really difficult things that we are dealing with is denialism. It's like the pandemic in revisionistic history, like the pandemic never happened, that not that many people were hospitalized for COVID, that we, upcoded hospital charges to reap more money financially, that individuals who passed away from COVID died with COVID rather than from COVID. And that vaccines don't work, and and that there's a whole conspiracy behind development of vaccines from the pharmaceutical companies. There's so much misinformation, false information, which is out there, denialism, people denying the impact of COVID, denying the value of science, denying the impact of public health, individuals denying climate change. This is what was center stage 10 years ago. And look now, I'm not sure we're going to be able to, catch up. I was really glad to hear previous interests in terms of climate. So it's very, very difficult. And how do we overcome this? It really has to be, common, drumbeat of reason and fact. One of the things that we have learned is the value of local community coalitions. Who is the trusted messenger in the community? And now more than ever, it's important for departments of health to have those ties so that you can end up having a trusted voice in the community that the community will respect to speak about things. One of the things along this line is, when I started in my role, I called up every state senator and spoke with them. I spoke with all the representatives on the House in the Healthcare Committee. So they had a relationship with me. And Republicans, Democrats, it didn't matter. And when they had questions, they would call me. And then during the pandemic, they would call me when they wanted to know, Scott, tell me really what is going on here. Is the governor right? Are you right? And, and that really goes a long way. So again, it's a lot of work in terms of making these coalitions, making sure that they respect and trust you. But those are the kinds of things that we're going to do. We're losing the battle. We're losing the social media battle. So much information can be put out there that people blindly follow.
Scott, thank you for the, it's humbling, but we keep going, we keep fighting, right, Scott? I mean, we're not gonna, but I want to turn to DM. She had a few more questions to
Sure.
also talk about, just in terms of leadership and what makes a great leader. And I'm going to turn to DM for those questions.
Thank you, Dr. Nazarino. Dr. Rifkes, in leadership, we learned about a great leader being someone who embodies the concept of population thinking and understanding that the health of individuals is intertwined with the health of the population as a whole. Being visionaries, we learned about mobilizing communities and organizations to address complex public health issues effectively. So as we delve into this topic about leadership, I'm just going to share a bit about my own approach to leadership. So my superpowers, so to speak, lie in me being an innovative, driven, creative catalyst. I managed projects, people. I use out-of-the-box ideas to solve complex problems. I architect and build holistic relationships and teams. And finally, I'm a luminary. So hearing these superpowers, with this in mind, Dr. Rifkes, in your opinion, what are your superpowers as a leader in public health?
Um, I don't have any superpowers, nor do I make any pretense to have any. But in terms of some of the skills and things, uh, um, I like thinking about things from a different viewpoint and a different lens. Never satisfied to think about things the same way. Um, when I teach medical students during rounds, I'll always ask them, say, all right, what's the disease pathogenesis and what do we not know? And what do we need to learn, in terms of understanding how children are affected and how we can treat them better. So always not being satisfied, always pushing the envelope. I think another thing, and this takes a while to do, leadership is experiential, is making sure that you can really take the step back and hear what the other people around are telling you. Uh, that's really important. I've worked with really, really, wonderful individuals that I still speak with now to get advice. Never satisfy with not getting advice and then reading. During the pandemic, my day, I'd wake at 5:30. I'd be at my desk at 6. I'd look at the data. I'd come home from work probably 7:30. I do my rowing machine for an hour. Then I would read for solid 3 hours what was going on. And the media was so far ahead of the medical journals. So London Financial Times was wonderful in terms of information. They had COVID. I just read and read and read, trying to get as much information as I could. And then I think the other thing which I mentioned was just going right to the top. Don't be afraid to call up the U.S. Surgeon General. Don't be afraid to call up the FDA commissioner. Don't be afraid to talk to Deb Burks, who we would speak regularly. So, I would say probably, those were some those were some of the traits. And I would say over time, becoming a little mellower, also I think also helps with that.
Thank you.
Not that people think I'm mellow.
Dr. Rifkes, you also mentioned having a trusted message in the community and a trusted voice. So with that being said, my question is around what strategies can public health leaders use to ensure that health equity is incorporated into public health practice?
I mean, there's no community without we the community. And so we had lots of different examples for this. So, we had a whole program in Department of Health, Health Equity. And I was really proud of the fact that one of the last bits of legislation that was passed before I left sponsored by Senator Rouson, was that each county health department would have a health equity officer who would reach out into the community. So in an organization, you have to have somebody who knows the community and is going to be able to reach out, into the community. One of the things that was probably, one of the most touching spiritual things that I did during the pandemic is I would have calls with faith-based leaders in Florida, 16,000 on a Friday before weekend services. And they would start off, they would bless me, and I needed all the blessings we could at that time. But I always thought that that was such a powerful tool, being able to reach so many people. And my dentist in Tallahassee, Dr. Scott, he was also a minister, and I remember being the dental chair, like the day before I was supposed to address faith-based ministries. I said, Dr. Scott, what suggestions do you have? And he says, tell everybody that they are shepherds of their flock, and it's their job to protect their flock. And those are the words that are used, and just trying to convey that message that they have an important role. They have a trusted voice in the community, and they can do something. They can keep their flock safe.
Thank you. I just have one more quick question. What advice do you have for someone who is getting their MPH, or how does one choose the specialization in public health, government versus academia versus for profit?
Part of it has to do with what what you're interested in. And, right now, there has been a huge loss of individuals in public departments of public health all across the country. And there's funding from CDC supporting public health infrastructure where they can hire individuals, but there are huge workforce shortages. So, so DM, first, what are you interested in? And you can look for positions that way. The CDC has a website, where public health positions are posted. The Association for State and Territorial Health Officers, AASHTO, also happens to have a job board. What part of the country do you want to live in, and whether you want to go into academics, whether you go into public health, whether you go into industry. You can look at what different opportunities are and where you feel comfortable, and it's not set in stone. You can always change change what you're doing later on. So so hopefully that makes sense.
It does make sense, and I'll just end by saying I appreciate the breadth of your background. I also have a background in genetics. I studied under David Allison at UAB around taste genetics in women with high-risk HPVs, and then I moved into cybersecurity. Now I'm here at Brown, so
Perfect.
I do appreciate you saying that you can move around. So thank you so much for answering my questions. Thank you, Dr. Nazareno.
Yeah. Well, you have a curious mind. And
Yeah.
so, just the important thing is to build off what you have done before, which the experience you accrue is not to be slighted or underappreciated.
Thank you
you.
so much, DM. And thank you to all our moderators for those questions. I think I got to know you a little bit better, Scott, thanks to those questions. I kind of knew you already, but I really admire how you shared so candidly all of your experiences. We just have just a couple more questions, a little bit more general. In your opinion, what are the most pressing challenges and opportunities public health students face today, or public health professionals face today? You touched on this a little bit, but maybe you can dive into that a little bit more.
During this pandemic, we had we actually had two pandemics. We had the pandemic of COVID, and we had the pandemic of misinformation and the undermining of public health. And it's going to, the COVID pandemic is still here. We're still unfortunately going to have 50 to 100,000 people die a year in the United States due to COVID because they don't get vaccinated and they don't get Paxlovid when they are ill. People should not be dying of COVID right now. And we also have the pandemic of misinformation, the pandemic of denialism. And this is one of the things that is really going to make it our jobs difficult. If we're doing, certain kinds of things, whatever we do in public health, it's for the public. And how do we engender confidence in the public to listen to what we are saying? And this is a huge challenge we have right now. One of the great things about the School of Public Health under Dr. Jha's leadership is what are the things we need to focus on? So you started the Pandemic Institute, Jennifer Nuzzo leading that, and then also the Information Futures Laboratory, because we can fight viruses, but we also have to make sure that we can communicate and be able to reach the public in confidence. Since you're putting articles in the chat, I've written some other articles about the impact of denialism on public health. Every couple months I either write something in the Stat, The Hill, or Time Magazine. And why am I doing this? Well, every time I write something, I get horrible emails. But right now, look what's happening in Florida. The medical community is afraid to speak. And so, I'm a couple years out now, and I do feel that Daniel asked about a moral compass. I believe part of this is my moral compass to actually help people understand, what they can do to protect themselves.
Scott, so we know about the measles outbreak in Florida, and you've been writing about it, and thank you for writing. I want to get to where did all this distrust come from? Where does that stem from? And I think you're exactly right. We are bringing communications courses into our program. We are talking about leadership in our program, because if we don't lead, others will on our behalf. And so we need to take ownership of our the work that we do. And you see this interdisciplinary group of students that are attracted to public health, but I'm just, again, we are battling that mistrust as well. And where does that come from, you think?
Yeah, it's, again, this goes back a ways in terms of the loss of community in society being replaced by tribalism. David Brooks, who a great writer, he's written about this. I remember, one of the books he wrote, he talked about how we're devolving from community into tribalism. And this has become really, it happened before the pandemic. And it certainly became exacerbated during the pandemic. And thinking about this politically, we had a very contentious political election. A lot of people still don't believe that Joe Biden, won the election. And so the departments of health and red states, blue states, the approach really was the same going up through January, February of 2021. David Wallace wrote a really nice article about this in the New York Times. And then there were a couple clashes. One, keeping kids out of school and closing down businesses. Well, this caused a lot of pressure, on society, a lot of economic pressure as well. And you ended up having different states taking different types of approaches. And so that led to, a divide among red states and blue states early on. We opened up schools in Florida in August of 2020, and they opened up safely. And that wasn't by accident. We spent nearly $1 billion to help the kids go back to school. So then you ended up having blue states saying that red states are doing things wrong then, at this time, you're killing kids. So that was one major deviation in terms of keeping businesses closed. We went up to 20% unemployment in the United States in the early phase of the pandemic, and a lot of economic pressure on doing things. So that was, economics in schools was one thing. Then I think another major deviation was April 2021. President Obama and President Biden have an event. Come on, people, roll up your sleeves and get vaccinated. When I heard that, I called my contact in the White House. I said, please stop. After that, you never heard Republican governors promoting vaccines. So vaccines became Democratic, and then the notion took place, it's better to get COVID and get natural immunity than to get vaccinated. So that was another major divide that ended up happening, and that continued to worsen. And so again, because you have people not promoting vaccines, then the Biden administration says, all right, well, we're not out of this. We're going to have mandates. Mandates don't work well in the United States. We are a society of individuals who don't like being told things. So that created another schism, which was there. And then, so, there were certain kinds of things that I think if they could have been done differently, we wouldn't have been so divided. It got to the point where, David Leonhardt, columnist for New York Times, I remember reading this column, Red COVID. The biggest risk factor for people dying during COVID, during the second and third years of the pandemic, wasn't age, wasn't medical vulnerability. It was who you voted for. And it shouldn't be that way in this country.
Thanks, Scott, for
Thank you,
that.
Scott.
Yeah.
We just have a couple of questions in the chat spot that I think it'll be nice if we can cover them both. The
Sure.
first one is from Claudia, who says, I'd really like to thank Dr. Rivkes for sharing his experience coming from a state university. I would also like to ask if he has any advice for people in healthcare who currently work with public health.
Yeah, I mean, we had lots of individuals working in our departments of health with a healthcare background. And I think you need to have a healthcare background in public health. So, lots of opportunities that way. Most states will have vaccination programs, will have epidemiology programs, will have disease surveillance programs. There's so many different areas where public health and healthcare intersect.
Thank you, Scott. And then we have another question from Ariel, who says, thanks, Dr. Rivkes. You mentioned that there are a lot of shortages in the workforce and public health departments. Can you speak more about why? I'm curious if burnout of previous public health workers is a part of this picture, and if you have advice for those at risk of burnout.
Yeah. So first of all, public health and healthcare have huge shortages, workforce shortages now. Part of this has to do with, training programs. We don't have enough training programs for people in the health professionals to be able to meet the need. In terms of sometimes salary structure, the salaries in public health often, they're often be half of that in the private sector. So, that also plays into the thing. And as far as the issue, and plus, getting back to healthcare sector, we're seeing the healthcare sector getting older, physicians retiring, not enough physicians coming in to replace it. Same thing for nursing. I think the average age for clinical nurse now is in the mid to late 50s. So, we have to look at what these training programs are. How do we address these issues? And as far as the issue of burnout, during the pandemic, you know, the hours people were working was incredible. The stress people were under, was incredible. I mean, just reflecting on it, personally, I remember myself and my deputy chief of staff, um, Shamira Robertson, who you may have heard from. Yeah, Shamira is great. I talked to Shamira earlier today. We're really good friends. We would sit there and we'd say, geez, there are 22 million people here. We have got to get this right. And going to bed with that weight on your shoulders is really difficult. And so, but you learn to deal with these different type of stresses. And as far as issues with burnout, I know that there are CDC programs that many places are implementing. Many departments of health, will have special types of events, activities to help with, to help you feel good about yourself at work, times to relax and things like that. So there are different strategies for that. The big thing is though, if you're starting to feel burned out, talk to somebody, talk to your supervisor, find somebody else you can talk to, because sometimes just doing that, they'll say, all right, what's your pressure point? Let's try to work this through.
Scott,
Thank
we're
you so
almost
much.
yeah, thanks, Scott. We're almost at time.
Okay.
We can keep on, we would love, I mean, we could talk to you for hours. The wealth of knowledge and your perspective really is so critical and important here at Public Health. And again, just want to reiterate, we're so grateful that you are here at Brown at the School of Public Health. And is it okay if our students continue to reach out to you? We're just, would love to continue the conversation. Is that all right if we continue just to engage and get, just to continue?
Yeah. I mean, of course. I mean, the first course I taught was in the fall of 2023. Fall of 2022. I still hear from the students in my course then. The students I taught over the summer, the students I taught in the past fall. That's what makes Brown really special. First, you guys are fantastic, the student bodies, and the fact that there's so many connections that are made easy between faculty and students. So absolutely, I can talk about this all day long. So.
Thank you so much, Scott. We really appreciate it. I think if there's one key message I'm leaving with today, it's that, no matter what, in the face of adversity, just roll up your sleeves, focus on the work, and cut out the noise. And that will be your guiding factor, I think. So I think I'm leaving with that message. And I think all of our attendees here are really inspired hearing you talk about how you just focused on the work and kept at it in the face of so much adversity you faced.
Well, thank you.
Yeah.
And
And
those
thank
of
you
you
so
in
much for your
Florida,
time.
know what you
Yeah.
need to do. Do it.
Thank you, Scott. And thank you so much again for our moderators for hosting and moderating this conversation. It has been a pleasure watching you all interact and hearing from Scott and from all of you. So I'm going to stop the recording here.